Hey, my name's Adam Arias and I'm a stroke coordinator at UF Health. And we wanted to take the time to give you guys a little heads up. It's May and it's Stroke Awareness Month. There's some information that you're going to need to hopefully keep your community, our community, and your family safe. First thing we want to know, what is a stroke? Some people are not really comfortable, they don't know what's happening, it's kind of a scary time frame. But a stroke, simply put, is just a lack of blood flow to an area of the brain. There's different types of strokes, which you'll learn more about that if you end up in the facility, but the main ones are a clot stroke, which is blocking the blood flow, and another one is a hemorrhagic stroke or bleed, where a vessel bursts and the blood is going in a different direction. Next, we'll go over risk factors. Some of the big ones we got are high blood pressure, high cholesterol, we're looking at diabetes and smoking. All of these can really put you at a higher risk for stroke or cardiac issues. So we want to make sure that you've met with your physician or your providers to lower your risk. You can take medications, we can look at diet and exercise, which is a big factor, something that you can do on your own. There are studies right now that show that just walking 20 minutes a day briskly can lower your risk by 20%. You don't even have to pay anything for that. So let's go ahead and take advantage of the wonderful weather we got out right now and take a few walks. Next thing we'll look into are signs and symptoms of a stroke. Signs of a stroke are pretty easy to notice, but it's scary at the time. So if you see facial droop, maybe your family member or friend is just not talking right, there's some slurring going on, you notice weakness on one side, it can be both limbs or sometimes it's just one, or numbness and tingling, these are all signs of stroke. One of the biggest acronyms or infographics we utilize is F.A.S.T. F.A.S.T is simply put, F is for facial droop, A is for arm weakness, S is for slurred speech, and T is time to call 911. Always remember to use our local EMS services. They're a great way for you to get the best amount of care as quick as possible. Upon arrival to our facilities, whether you come in via EMS or through triage, it's going to be pretty fast-paced. You'll feel like it's a NASCAR pit crew coming at you. We're trying to get information, history, labs, and rush you off to CT so we can start your treatment or at least make the decision as soon as possible. After all of this is done, we'll get you into your room, your family member can be with you, and we'll begin to start the process of educating you a little bit more about preventing strokes in the future. You'll see physical therapy, occupational therapy, and speech. They'll come in, evaluate you. They'll see what deficits you may have gotten from the stroke, if any, and if so, we'll create a plan. So on your way home, you'll know exactly what you got to do next. That might involve outpatient rehab, or even you might have to stay at a rehab facility. It is kind of scary, but it's the perfect thing for your care, and it's the best way to get you as close to back to normal as soon as possible. Here at UF Health, we want to do what's best for our community. We want to give you all of the information, all of the data, all of the tools that you can to keep you and your family safe. So do not hesitate to come in. Don't feel bad about asking simple questions. That's what we're here for. So thank you for joining me in these few minutes to learn about stroke. Remember, May is Stroke Awareness Month, so use these tools and information we've given you to spread it out to the community, your friends and family, and stay safe and healthy.